Come in.
Hello, my name is Taylor. I'll be your student nurse today.
Hello, how are you?
I'm doing great. How are you today?
Can't complain.
Okay, can you verify your name and date of birth?
Yep, I am Terry Shickshaw.
And your date of birth?
10/29/1952.
Okay, great. Thank you so much for verifying that. So I'm going to check your orders. It looks like the physician would like for us to do a respiratory, a cardiac exam, and musculoskeletal as well as neurological. Is it okay if I touch you in order to assess these?
That's fine, but I'm a little older, so I'm a little sensitive to touch.
Okay, that's fine. I'll make sure I'll be gentle, okay?
Okay.
All right, so first we're going to start with your respiratory. Have you had any coughs or shortness of breath?
Just a little cough.
Okay. And do you cough up any phlegm or sputum?
No.
Okay. How long have you had the cough?
Probably about 6 months now.
All right. I'm going to listen to your lungs, okay?
Okay.
Do me a favor and take this arm and go across your chest for me. I'm just going to listen to your lateral here.
Okay. There's a little phlegm though. Yeah, there's a little phlegm there. There's a little phlegm there.
Is the phlegm just like in the back of your throat? It doesn't come up when you cough, right?
No, it's not that heavy in. It's just like right at the throat part.
Okay.
It's not coming from the deep within.
Alright, we're going to do the same thing. Just sit up forward for me and I'm going to listen to your back. Thank you so much. All right, lung sounds are clear in all 4 lobes.
Great.
No adventitious breath sounds, which is just abnormal breath sounds like crackles, wheezing, bronchi, shortage, things like that. So that's good. No obvious sign of respiratory distress. So now we're going to do a cardiac assessment. Do you have any past medical history of cardiac problems, any heart surgery?
No.
Okay, any heart palpitations?
No.
All right, I'm going to listen to your heart sounds.
Should I sit up?
Mm-hmm.
Okay. Great.
All right, and I'm going to listen again, but this time I'm going to listen for murmurs. Okay, I do not hear any abnormal or any murmurs. And I'll check your aortic, your pulmonic, Erb's point, tricuspid, and your mitral valve.
Okay. Sounds like a pretty big word to me, but I trust your judgment.
Okay, good. All right, I'm going to put my patient in 45 degrees and check for JVD on both sides.
Okay. What's JVD?
So that is jugular vein distension.
Ah, that's cute, JVD.
Mm-hmm.
I thought it was some type of Home Depot piping.
Oh, wow. Okay, but you know what? It can actually look like piping. Your vein can actually look like piping if you have any cardiac issues, and so that's why we check for JVD.
Oh, okay.
So now we're going to check for, I'm going to check your capillary refill.
Okay.
Alright, capillary refill is under 3 seconds bilaterally. I'm going to check it in your toes as well.
Okay.
Okay, great. Alright, I'm going to check first edema. Let's just make sure you don't have any fluid retention anywhere in your body, which can indicate cardiac issues as well.
Okay.
All right, looks good. No edema noted. Let's see. Now we're gonna check your pulse
Okay.
on both sides. Make sure they're strong.
Okay. Doesn't matter if my legs are crossed or not?
Yes.
I'm crossed. Okay.
Thank you for asking that.
Okay.
All right. Radial pulse is a +2, which is regular, bilaterally, and I'm going to check for your dorsalis pedis.
Ooh. Sound like salad with peanuts in it.
Salad with peanuts.
Pecans.
Okay. Dorsalis pedis presence pulses are +2 bilaterally. And we'll also check the carotid, which we would never check carotid at the same time. Okay, bilaterally, carotid pulses are +2 as well. So all pulses that I've assessed are normal. The other pulses that I could check would be the posterior tibia, the popliteal femoral, which would be located in the groin, brachial, and the axillary.
Okay.
Okay.
And I don't really need those checks because I'm sounding pretty good so far?
Yes.
All right.
Yep. So now we are going to do, a neurological. So we want to make sure that you're all good in the head, I guess.
Okay, I am 73, so I forget stuff every now and again.
Okay, that's fine. Can you state your name for me?
Terry Shishaw.
Okay. And do you know where you are right now, or can you tell me where you are?
I'm in my doctor's office with
Okay.
a nursing student.
Okay. And do you know what year it is?
Well, last time I checked was 2025.
Okay,
But
good.
it's going pretty fast now.
Mm-hmm. And do you know around what time it is in the day?
My appointment was at 3:30, so I'm thinking about it's about 3:45, something along that line.
Okay, good job. So my patient is alert and oriented. Times 4. And I'm just gonna assess your pupil. Have you had any history of migraines or headaches?
No.
Okay, any history of seizures?
No. I'm a little jokester.
I see, you almost scared me, girl.
Stop looking at me.
Okay. Your pupils look like they were at 4 and constricted to 2, which that is a normal reaction when you do a pen light assessment.
Yeah, because it was kind of like all in my eyes.
I'm sorry.
That's okay. During headlights. Should I follow?
Yeah, I gotta get better with that.
Okay.
I gotta get better with that.
Okay. It's pretty good. It's quick and simple.
Okay. Okay. Alright. Let's see. No history of seizures. No history of stroke or anything like that, right?
No, ma'am.
Okay, great. Alright, so next I'm going to do a musculoskeletal assessment, which is just your muscles, your bones, everything that allows you to move.
Okay.
Okay, so we're going to assess your forearms. So can you do me a favor and stick both your arms out? Okay, and then push down for me. Push down on this one. And then push up. Great. All right, and then turn your hands over this way. All right, and push down, push up. All right, so strength is there. All right, next we're going to check your feet. And what I'm gonna have you do is, for this foot here, push down like you're pressing the gas pedal. Okay, and flex up towards the ceiling. All right, I want you to push down again like a gas pedal and push up towards my hand. All right, same thing with this one. Have you push down like a gas pedal, up toward the sky, push down on my hand, and push up on my hand. Great. Lower extremity, the feet, strength is there. I'm working on vocabulary.
Who are you talking to, young lady?
I'm just doing an assessment video.
Okay.
Okay, is that okay?
That's fine.
Okay, thank you so much for that.
Should have got me on my best side.
So now we're just gonna do a quick safety thing. This is just gonna be part of your discharge plan when it is time for you to go home. And that is gonna require me to check your gait. So if you could do me a favor and first thing first, have you had any history of recent falls?
No, it's been a long time since I've fallen.
Okay, what's a long time?
2 days ago.
Okay, that's not that long ago.
Wow.
Do you use any walkers, canes, or furniture when you're trying to get around at home?
No, I just happened to slip on a little grease stain at the house.
Okay, yeah, that's not good.
No, it wasn't a bad fall. It was soft, little.
Okay. All right, so we're gonna talk a little bit about some safety at home to make sure that we can avoid falls. Okay.
Okay.
You can really get injured with falls. So I'm gonna test to see how you can ambulate. So if you can do me a favor and stand up for me. If you need assistance, let me know. All right, take 2 steps forward for me, towards me.
1, 2.
Perfect. And then I'm also going to have you do. Close your eyes and hold your hands out. Perfect. And place them down for me. And you can open your eyes. And I'm gonna whisper something. You repeat it back to me. You don't have to whisper it back, but okay. No.
Now. 86.
Okay. All right. We're gonna work on that left ear, but the right ear was fine.
Did I say 86?
I said ABC.
Oh.
I said ABC. All right. All right. You can go ahead and sit back in your bed, whatever the case is. Yeah. Great. So now that we have that done, we assessed the whisper acuity test, which, like I said, in the left ear you did not pass, and the right ear you did. But don't worry, we're gonna document that. We're gonna work on that. Okay? Do you wear any hearing aids or anything like that?
No, I just take my ears out too, so that's a little odd.
Okay. Don't worry about it. It's okay. Next we are going to talk about a little bit of safety at home. You don't use oxygen or anything at home, right?
No.
Okay, good. So if you have any cords, you want to make sure that they're secured and out of the floor walkway. If you have any rugs, you want to make sure that they're planted and secured as well. The grease stains, you definitely want to try to pay attention to those.
Yeah.
And water spills, yeah. Just a little bit can send you to the floor. Yeah, so we want to make sure that we avoid those falls with those things. So just kind of pay attention to your surrounding areas and making sure that your floors and walkways are clear.
Oh, that's probably why my body's been a little sore. Okay, that would explain that.
Okay, I'm going to also document that in your chart. The last thing we're going to do is we're going to talk about an incentive spirometer, which is this thing here, and this allows you to keep your lungs inflated and keeps air moving and keeps your lungs from collapsing. Okay.
Okay.
If you were bed bound, we would do a cough and deep breathe, which will require you to just turn and do a cough. There you go. But instead, you would just turn to your side and cough. But this is an incentive spirometer. Okay, and what you do is you inhale, and the goal is to get this ball to come up.
Okay.
To rise, okay?
Okay.
And we want you to do this 10 times in an hour. So we say typically every commercial break.
Okay.
Okay? I'm going to have this here. Your call bell is here. If you need any assistance with going to the bathroom or getting anything, please feel free to use your call light, and someone will be in here shortly.
Sounds good.
All right. Thank you so much for allowing me to assess you. I'm all set with my assessments.
Great. Thank you. You were great.
Thank you.